and mind. Our next session, Healthcare's Evolution and the Power of Measurement, Why Nutrient and Antioxidant Status Matters for Health and Cellular Wellness, brings this perspective into focus, highlighting how tracking what's happening at the cellular level can shape more informed and proactive approaches to health. Let's put our hands together for Dr. Greg Caldwell, Doctor Optometry and co-founder of Optometric Education Consultants, as he reveals how nutrient and antioxidant status is shaping the future of healthcare.
Perfect. Thank you. Thanks for that nice introduction. Is this anyone's cell phone? Now that I got your attention? Haha, all right. So I'm an eye doctor. I studied allopathic medicine for about the first 20 years of my life. That means opposites cure, right? And I had patients coming in asking me for macular degeneration, would resveratrol work? And I said, I don't know. KNOW, I didn't say no. I need to research it. Can astaxanthin work for my glaucoma? Can CoQ10 work? And I had to keep saying, I don't know. But I didn't say no. I wasn't that narrow-minded. So I decided I was going to try and find out the answer to that. Well, I'm a KOL in optometry, key opinion leader. I thought it would be pretty easy. I knew a lot of industry, knew a lot of the supplement companies within eye care. And when I would go in and I was looking for that data-driven wellness, I wouldn't find it. I found maybe a couple doctors that read a bunch of white papers, that put a formula together. I could have done that. My buddy Trevor's out at the booth. He and I are pretty smart guys. We could have read some white papers, found some lab, and called it maybe Amazing Eyes. A lot of people do that, right? I wanted data-driven wellness, and that's what goes on with the theme here. Technology, trust, and the road ahead. Within technology, I wanted to be able to measure someone's antioxidant status. Now I can do it in 15 seconds or less. It creates a great conversation. I can now then give them a solution, a data-driven solution for when I find the problem. Maybe help break their addiction, which we're going to talk about here shortly. So this works perfectly for the great healthcare shakeup, technology, trust, and the road ahead. The reason being, I was watching people lose vision from metabolic conditions which are reversible, right? Or treatable or preventable. I was watching people lose vision from chronic diseases, watching them lose it from macular degeneration. And they're looking for naturopathic reasons or ways to do it. So if you're looking for a naturopathic, a nutrition way, then there's a solution here that I'm going to walk you through, but also to focus on the great healthcare shakeup, technology, trust, and the road ahead. Okay, so let me go through some slides here. And you can see here that it's your body's report card. There we go. So real quick, we have macronutrients. There's a big focus on it right now. Everything's this protein-driven society, which is great. We want to get away from those carbohydrates. Out of the 3 macronutrients, that's the one that carbohydrates are the ones that become addictive. You cannot become addicted to protein, can't become addicted to fat, but you can become addicted to carbohydrates. We've all had this. Everyone in here ever eat a bag of Doritos? Did you ever get that real cheesy one? Everyone's got it. Is that done on purpose? Yes, food scientists have done that. Because carbohydrates can become addictive, and now you overeat. Subconsciously, you keep eating, and hopefully you'll get another cheesy one, right? So like you heard me yesterday, if you were here when I was part of the panelists, I would say, what are the benefits of smoking? There really aren't any, right? Everyone looks at me and says, what are the benefits of smoking? There really aren't any benefits of smoking. But if you said to someone that smokes, hey, it causes cancer and emphysema, it's not that they're going to say, hey, I never smoked again. They're going to continue to smoke because they're addicted. And whenever we look at the 3 pillars of health, exercise, sleep, and nutrition, and I say to you, if I told you that exercise will decrease, if you did it 90 minutes a week, will decrease all causes of mortality by 14%. Sleep, I hear people say, I'll sleep when I'm dead. Well, that might come a little bit sooner than you think if you don't get that 7 hours of sleep. And nutrition, I think we all know nutrition is good, but we all don't do it because why? We're addicted to foods and we're addicted to our hormones, and there's things that we have to do to break it. So macronutrients are important. Micronutrients are important. They regulate, they protect. They're needed for smaller amounts, needed in smaller amounts, but are essential for health and ocular conditions. So the macronutrients are energy and building blocks, and the micronutrients are regulators and protectors. Most Americans and most people in society are micronutrient deficient. And the only way you can get micronutrients are what? To eat them. So most of us don't eat enough micronutrients, and so now our homeostasis is off. So wouldn't it be great to know if you had low-grade chronic inflammation in your body? Know your fruit and vegetable intake. Know if your supplements were absorbing. Had lower risk for chronic diseases. Or know your antioxidant status. Wouldn't that be cool if you could do that? And you can in 15 seconds or less. You put your finger on here, you get a score. This, every time I put someone's finger on here, a 15-second scan is usually minimum a 5-minute discussion. Because it really now becomes an eye-opener. Whenever you now look at that score, try to figure out why it's high, why it's low. Most of the time it's low. All right, chronic disease. The world does not come to us for chronic disease. Europe is a heck of a lot better at preventing chronic diseases, right? There's over probably 200 chemicals that they in the EU that they don't allow in their food sources that we allow. I know whenever my stories, every time I go to Poland or Germany, I pick up a bottle of ketchup. It says tomatoes, vinegar, salt, water. Pick up a bottle of ketchup here, and it's got hydrogenated something and poly something and whatever something else in it. And you're wondering why they don't come to us for chronic disease management. They don't come to us for prevention. We're great at acute. We all know that person having a heart attack, took a couple aspirins, take them to the hospital, someone, man or woman, comes zooming in on a Porsche, sticks a stent in and prevents it. We're great at that. The world comes to us for those repairs in our knees. You know, when they have the star soccer player blows out their ACL, they come here. We're good at acute. We stink at chronic, right? No one comes to us for the chronic part. And that's why when you look at life expectancy and health expenditure, we're one of the worst in the country. And we know that low-grade chronic inflammation causes cancer, cardiovascular disease, Alzheimer's, diabetes, autoimmune, neurologic, whatever you are. I always love giving this talk in Vegas because if you have a low score, it's like going to the roulette table, let it spin. Are you going to be something up in your head? Is it going to be Alzheimer's, dementia? Is it going to be an eye? Is it going to be lung, heart, anywhere of the organs? Where's that going to stop when you have that low-grade chronic inflammation? When you have a low score on this scanner, like I hear people say, oh, I might not even come to class tomorrow because I'm going to be dead by tomorrow. No, this is not an acute problem. This isn't your blood sugar being through the roof. This isn't a blood pressure being super high. It's not an acute problem. It's a low-grade chronic burn inside. And when that roulette wheel stops, what disease is it going to stop on? Right? So that's why I like to focus on raising people's micronutrients. Getting that low-grade chronic inflammation away from the body and stacking the deck in their favor. When it comes to chronic disease, we want to stack the deck in their favor, and this becomes part of the strategy. It's not the only way that I'm treating glaucoma and macular degeneration, but it's part of the strategy for helping people and prevention and wellness, longevity, anti-aging. Here's our food sources. I take the pictures all the time. I walk through. Bananas are the easiest. What do you think the color of this bananas were when they were picked? What color were they? Green. You can see it. How about those oranges? You can see they're still green. This is the problem with our food sources, is that tomatoes, apples, everything's picked green. And I always use the analogy of a baby. If a baby's born at 8 months because it's disconnected from mom, it usually ends up in neonatal intensive care because it hasn't matured yet. Our fruits and vegetables, when they're connected to the vine, the tree, the plant, they have to be connected light, dark, cold. And as they turn from red or green to red, green to yellow, or green to orange, now they become micronutrient dense. When they're picked and put into a gas chamber and then shipped for months and then turn green, they're not going to become any more micronutrient dense. And that's why it takes 21 oranges of today to meet one of years ago. And the same thing over and over again. And that's why they tell you to go to farmers markets, because the farmer picked it the day before and then is selling it to you. So it's now micronutrient dense. Our food sources, right? And we see this all the time. 21 oranges of today of 1950. We have all kinds of stresses out there that create oxidative stress, whether it's inflammation, your own metabolism, making ATP. It's not a clean system. It produces free radicals. Smoking, oxidation. When you walk outside on Las Vegas boulevards, traffic everywhere. You're breathing in. You're creating oxidative stress in your body. And you better have your fruits and vegetables on board, because you're creating free radicals. Free radicals, all it means is missing an electron. Your body loves homeostasis. So it's going to use a cell membrane, it's going to use DNA, it's going to use the mitochondria, it's going to use something. But what you want is your score to be high so that the organs of your body are saturated with antioxidants, because they want to give up that electron. You don't want it hitting the DNA. You don't want it hitting the eye and creating macular degeneration, or causing that to be part of the macular degeneration, causing it part to be the glaucoma or the diabetes, the receptors. If someone's trying to take a medication and the receptor is oxidized, and now that medication won't work as well. So again, it becomes part of the strategy. We have, whether they're internal ways of getting oxidative stress or external, we're always bombarded. But the equalizer is supposed to be our fruits and veggies. And now in this big, heavy protein society, what are people cutting out of their diet because they're afraid of those carbohydrates? Fruits and vegetables, right? Because now they're trying to go protein heavy. And what is the only way that you can get vitamins and minerals? Can your body produce them? No. They're exogenous. It means you have to eat them. Your body cannot produce them. They're not endogenous. You have to eat them. And now we're cutting out our fruits and veggies. And that's why good supplementation, data-driven wellness becomes important. And that's what's been one of the biggest helpful changes the last 10 years of my practice. I'm an allopathic doctor. I studied nutrition, I studied naturopathy, and I kind of now do integrative. I didn't give up on my allopathic background. I always say I'm still going to treat a sty with an antibiotic, not an avocado. But then I also going to know what I did to that gut microbiome, support it, probiotics, prebiotics, postbiotics, give them some, measure their score, make sure they have a good micronutrient, and they're not deficient. So here's the American rainbow. I picked this up at the Atlanta airport. Look at those beautiful blue Almond Joys and the yellow Lay's potato chips and the Doritos. Look at all that processed food. And we wonder why we have such low scores. There's your American rainbow. You see it with the fruits and vegetables. Those were taken at the Delta Lounge, Marriott, and Hilton as I travel. And I take those pictures, and you wonder why as we travel. And now we're out of our sleep rhythms. And we have poor sleep. We're not exercising. We're eating processed foods. Then we think we're eating oranges that are so nutrient dense, right? And that's why I just supplement faithfully with my Life Pack every day and my collagen and my gut products. So 15 seconds can change your life. It's your body's report card, and that's what the Prism is all about. It actually, no one would take blood pressure medicine by saying, hey, it looks like you have high blood pressure. I'm just going to give you some medicine. Hey, it looks like your cholesterol's up. Let me put you on some Lipitor. We have to measure, right? That's what we want. We want technology. We want trust. We want data-driven wellness that's out there. Your body, again, we talked about the 3 pillars of health: exercise, parasympathetic system, sleep, recovery, and basically your nutrition. Nutrition comes down into macros and your micros. And I'm very big, as you can tell, on the micronutrients because there's plenty of evidence-based medicine, evidence risk-adjusted medicine that will help us out with our patients and clients depending on what setting you're in. So it's not anything that just came out. We've got 21 years worth of data. You can see at the bottom is the S1, S2. The one at the very bottom there was the S3. It's the one I used in my office. Basically, it was in physicians because it was about $4,000. It had a click fee. It had a contract. It had a lease. Now we can give these right here for $299. And my first two patients bought them. And that's where I want them. We want them in households. We want people breaking behaviors, changes. We want them changing their diet. We want them to get better. It gamifies nutrition. Out of those 3 pillars, I was here yesterday and I polled the audience, exercise, sleep, nutrition, which one do you think is the biggest to cause disease if you had to pick one of your own, if you just wanted to pick one? There's no right or wrong answer. Which one do you think out of those, the 3 pillars of health, it's like a bar stool. Take one away, it falls down. Don't exercise enough, don't sleep enough, nutrition. But which one do you think would cause the biggest part of that disease process? Right? Everyone always says it, nutrition. So why wouldn't we measure it? Why wouldn't we help our patients out? We got 21 years worth of carotenoid research, 28 million scans, 20,000 light measurements and readings in 15 seconds in proprietary technology. It's not something that's new. Raman spectroscopy has been around for years. Back in 2014, the Yale Cancer Center validated that Raman spectroscopy is a biomarker, a great measurement for our nutrition and our status that's out there. So here's how it's done. You put your finger on it. It's using hyperspectral absorption. And we have a Raman database. We have some machine learning. So basically, you put your finger on it. It's the prism. The prism is filtering out the carotenoids. Now let me just pause and ask. Carotenoids are part of the antioxidant system. Vitamin A, vitamin B, vitamin C, polyphenols, flavonoids, carotenoids. So let me just, since you're just sitting in front of me, if I measured you and you happen to be low in carotenoids, do you think that you're low in carotenoids and everything else of your antioxidant status is optimal? No. So it's a great, and it's been proven, it's a great representative of your whole antioxidant status. Through science, proven, hundreds of studies, proven. It matches the blood. It matches the skin. It is a great biomarker, non-invasive, quick score developed by the National Institutes of Health to study at the very beginning cancer, and into my near and dear to my heart, macular degeneration. That's where it originally started, years ago. Then it went to the University of Utah to be shrunk down to be portable. And look at this now in 2026, able to be super portable and measure in 15 seconds or less. Create that conversation that's out there. So here is a scan, and you get a solution, and I love to call it data-driven wellness that's out there. All right, so we have a whole life pack family, right? This is what I do for my patients. So I don't want to create a problem. And what I love about the scanner is I'm not the one telling them that they have a crappy diet. They're not getting mad at me. There it is, right? You have a crappy diet, but it's not me saying it, it's the instrument. They fill out an antioxidant assessment form. It's not me being a salesy person. Now I can give them a solution. And we have a starter, optimized, and advanced. That's just in the antioxidants. We got a peptide, a bioactive collagen peptide. It means when you use it, it's going to go to work. We also have gut products. Because we can't be linear and binary, we got to think of the person as a whole. All right, let's see if this is going to work. So when you look at LifePak, people say, is that a good multivitamin? I say, yeah, you're about 1/7 correct. Because our clinical studies show, yes, it is a multivitamin, but it's also cardiovascular, bone. It's also immune support, blood sugar support, anti-aging, and an antioxidant formula. So when they say, man, that's a multivitamin, I say, yeah, you're about 1/7 correct. It's part of the whole part of that Life Pack family. All right, let's see if I can get my remote to skip. Move along. Here we go. Here's what I love about the country. Data-driven wellness. They will select from all over the world. They will source from all over the world and select. They will pick the product, whether it is a natural form, a synthetic form, whether it's the alpha, beta, gamma form. They'll have tight specifications, standardization. But what more importantly I like about it and why I put it in my body every day is because the FDA for contaminants is here. Theirs is down here. Every supplement's going to have a contaminant in it. You just want it low. And you want it low so that you're not micropoisoning yourself. And the last one, they call it substantiation, just a fancy word for studies, and they do it on humans. So they have human studies. I think the 7th one should be stability. People don't realize that if it's on the box, on the label, that it doesn't mean that it's in the vitamin. They have shown me, because I speak, and I speak a lot, and I speak in optometry, fitness shows, health shows, all across. If I'm going to have the confidence of speaking, they had to show me some data. So I signed a non-disclosure, and they showed me other people's products that they tested. That's not their MO, but what I like about it is if they showed me that it's supposed to have 10 milligrams, but because it's in the shelf and it's sitting there, it will break down. So it doesn't mean that if it's on the box, that it's going to be in there once it's sitting on the shelf for 6 months. They do stability testing. Whatever their expiration is, it's as strong as it is on day 1 as it is on whatever the expiration is, which is usually 2 years. So it's not going to break down. They have a 6S process, which is higher than the TGA because supplements in Australia are considered drugs. All right. So here's what I was talking about here. Knowledge is powerful, right? But it's logical. Yes, I know smoking causes lung cancer, but I can't quit because implementation is biological. And to change habits, you got to have something that is a behavior changing device. So implementation is biological, all right? And knowledge is logical. So we all know we should exercise. We all know we should eat better. That's logical. But we can't do it because of the addictions, the neuronal loops that are out there, and that device can help break it. And that's what all the other devices that we wear are supposed to do, right? The Oura rings, body compositions. When we take our continuous glucose monitors, our Apple Watches, sympathetic, parasympathetic. Apple Watch is sympathetic. How much exercise? Oura rings. How much are you sleeping? Now we have something. So I came up with all these different names. It's an addiction interrupting device, craving disruption device, habit breaking, loop rewarding, whatever you want to call it. That's what we're trying to do in nutrition. We have it in exercise. We have it in sleep. Now we have a way to break it in nutrition. So it's the rise of personal health monitoring devices. Antioxidant status shows inflammation, oxidative stress, nutrient sufficient, mitochondrial load, cellular recovery. And we have all these different devices that are out there. Now we have something that we can measure nutrition. And why measurement of oxidative status matters? The cost of treating illness is expensive, and the value of preventing illness is priceless. That's out there. All right. Here we go. We're going to have about 10 million devices in households by 2030. That's already started. When I was a part of the team with the old scanner, we had about 6,000 units out there. Since we launched this in January, we now have 40, maybe 50,000 by now. We have 40,000 devices. It's pretty cool watching these roll out. And the public and the doctors and the nutritionists, the dietitians, everyone is starting to embrace it because now we have a way to measure. And then we also have a way of giving someone a solution. And that's what this is. Very rarely do you see, and I've done it before, I have devices that come in as an eye doctor, and then their treatment plan isn't so good. Or they have a great treatment plan, and now their device isn't so good. Very rarely do you get a company that has a device and then has a scientific driven, they have 75 scientists, a scientific board, 14 disciplines that are making their supplements, Again, data-driven wellness. So as a doctor with my license, I don't really have to worry about it. I know that whenever I prescribe it, what's going to be in there because of their success process is going to be what the patient is getting and is well deserved. So you're getting intelligent solutions, trust, right? We want something that people can trust. I've been talking to a lot of people this last 2 days, and a lot of people know that kind of the supplement market's a little bit of a wild, wild west. So that's why I go with a company that has a scientific board. It's not Trevor and Greg just building it. They have 75 scientists in 13 and 14 disciplines, depending on, I guess, what time of year, and the team is changing constantly. All right. So I will pause because I want to respect the time, but I'll take some questions. And the reminder is, since this is being streamed live, we'd like you to go to the microphone to make the questions. There's one here, and there's one here for questions, or we can take you a microphone back. Uh-oh, we need some juice over here on mic to my left. All right, thanks.
So it's Nu Skin that owns the patent on this, is that right?
Nu Skin is
Owns the patent on this.
Yes, Nu Skin owns the patent on the Prism device. Yes, Nu Skin Pharmanex.
And is there any way, or have you considered, or are you looking into incorporating it into something like an Aura ring? Would that be a possibility?
So the question is, about regarding incorporating into an Aura ring. They're already working with a company called Full Sun to make or Full Power. You can look them up on the internet, Full Power, to integrate the Aura ring, to integrate things like Apple Watches and Whoop watches and this data to make a digital twin. So it's going to be really cool to see what they do with this data, putting it into kind of machine learning and AI learning. An example would be I live on the East Coast, and then once it gets my Aura ring starts feeding in, this is the future, I'm telling you what's coming, it's not here now, is that what's going to happen, and it's going to say, hey, I see your sleep pattern's off. You can put in, I was in Vegas for a few days, and it will help make a recommendation, like maybe their nighttime formula. So they're not going to really incorporate it into an Aura ring. Samsung already has a watch that measures antioxidants, which is really cool because it validates what we're doing, but it's not as sensitive. It doesn't have the proprietary database. It just says low, medium, and high. But it's really cool. If you Google it, Samsung has a watch that can measure someone's antioxidant level, but it's not as a number driven. It's just more quantitative rather than qualitative.
And what is the accuracy rate of this?
What is the
accuracy percentage?
Yeah, the accuracy they say was if you remeasure, you're going to be within 10% because you're never going to hit the same spot of the finger. So if someone comes in and they score 500, so 10% would be 50. So now you could say 550 down to 450. It's a little bit tighter than that.
But what's the accuracy if you were actually like taking their blood or measuring it physically?
Yeah, so there's been plenty of studies out there. There's 110 studies where the skin matches the blood, and more importantly for me, that it matches what's found in the eye, because the highest concentration of carotenoids is in the macula, the fovea. So they've done studies to show that they all match up.
Okay, last question. Will you just touch really quickly on how it is working? You did go over it, but you went really fast, and I was just wondering if you could.
Yeah, so in this technology, the question is, how's it working? It's using really bright white, and there's a prism in there filtering out the carotenoids. Carotenoids are yellow. It used to be a blue light, where yellow and blue make green, and then we knew the amount of green light. It was like 478 blue, hitting the yellow carotenoid, bouncing back a 618 green light. It's a different technology now using white light prism, and then it goes and filters out that carotenoid, talks to that Raman database, and now gives us a number. So that's a pretty cool proprietary science that they have using the 21 years of data that we have on carotenoids.
So I assume that you would do better with this prism measurement if you change your diet and use the Life Pack supplements and vitamins.
That is correct. So basically the question was, so I tell my patients, and I'll use this as the last question because it's 12:30 and I want to stay on time for the conference here, or it's 2:30. I want to stay on time. So I tell my patients, I cannot supplement you out of a poor diet. But what had recently happened to me with a patient, this big burly guy comes in and says, Doc, I know I need to do something. Tell me what I need to do. I put him on LifePak. And what he did is he came back and he goes, hey, this little inflammation spot has gone away. I think my score is going to be up. I'm eating better. Boom. And when he went out with his buddies, he said, yeah, we had burgers the other night. Instead of me getting those fries and that seed oil stuff I hear them talking about, I got a cow salad. So now I've made the behavior change. I made the lifestyle change. That was done by a measurement, him now thinking about it and gamifying it, breaking his addictions, breaking his behaviors that are out there. So yes, I can't supplement someone out of a poor diet, but yes, supplementing with LifePak to fill in the gaps, changing, really becomes synergistic.
So also, do you have some kind of guide of how long will it take to double your score if you take the supplements and you start eating like the rainbow diet?
Yeah, so the question is how will it double? Everyone's different because of the different inflammations and what the illnesses they have in their body.
Yeah.
But if they're perfectly healthy, I can usually double someone's score in about 8 weeks. So 2 to 3 months, I can usually double their score if they're healthy, just to kind of give you. Yep. All right, everyone, I want to be respectful of the time. So I want to thank everyone. I'll take questions in the back, but I don't want to be the one getting us behind on because this is always we can sit and talk. So thank you.